Substance Use Among Nurses, A Quiet Epidemic by Brianna Sykes. What is substance use disorder? According to the HHS, SUD refers to substance use disorder or substance dependence. It is the damaging use of alcohol, marijuana, opioids, and other drugs. For nearly 2 decades, substance use has been said to be the nation's number one health problem. Non medical use of prescription medications has become the nation's fastest growing drug problem. It's also a problem among stressful nursing students. The National Institute on Drug Abuse estimates that 10% of U.S. adults abuse drugs during their lifetimes. Accurate statistics are difficult to obtain because drug abuse and addiction are often cloaked in silence. The American Nurses Association, also known as ANA, says approximately 10% of nurses are dependent on drugs, making the incidence of drug abuse and addiction among nurses consistent with that of the U.S. population. With nearly 3 million RNs employed in the U.S., that means almost 300,000 RNs may be substance abusers. Put another way, if you work with 10 nurses, one of them is likely to be struggling with addiction. Why do nurses use drugs? It could be a number of reasons: personal, recreational use, or, they just want to use them. Who knows? Co-occurring disorders such as depression and PTSD, fatigue, stress. Nursing Time survey found that 63% of participating nurses experience physical or mental side effects of job-related stress. Drug accessibility. Many nurses self-medicate with painkillers to relieve a headache or reduce insomnia, which can lead to substance abuse. Dependence on prescription medications is much higher for nurses than use of, in addition to illicit drugs, like cocaine and marijuana, is much lower. According to the ANA, nurses most frequently abuse alcohol, followed by acetaminophenes, opiates, sedatives, tranquilizers, and inhalants. The signs and symptoms of addiction in nurses. Since nurses are a part of the health profession, they are aware of the signs and symptoms of substance abuse. Nurses are more than likely pretty good at hiding the signs and symptoms of their own use from others. Nurses may all of a sudden be the best nurse on the floor, being praised by patients that aren't even assigned to them, doctors and or administrators. Be the first to volunteer to work overtime on acute care units where narcotics are often administered. Changing personality or mood, acting more secretive or solitary, distracted or reduced job performance. Most of all, volunteering to administer controlled drugs to patients, has trouble focusing in meetings, has pinpoint pupils or is glassy-eyed, has visible shakiness or tremors, has an unsteady gait or slurred speech. We're going to listen to a YouTube video about the addiction among nurses. Just give me 1 second, and I'm going to play it for you. It is called Increase in Nursing Abusing Drugs, Medication Meant for Patients.
We've all heard about the crisis of heroin and opioid addiction. Experts tell me it's hitting the nursing profession hard. Records obtained by Action News Investigates show the number of state sanctions against nurses for using drugs is soaring. One nurse told me she ended up treating patients while she was high on heroin.
I'm an addict, and this is who I am.
She is also a nurse. She agreed to talk to Action News Investigates if we did not reveal her name. She got hooked on painkillers after a car accident several years ago, and the pressures of her job made it even harder to quit.
I would be on 12-hour shifts, but I'd be working 14 just to get my charting done. It was difficult. It was very difficult.
She did take some drugs from her workplace, but she worried about getting caught. So she turned to heroin.
I would leave on my lunch break and go get what I had to get because I was right in Oakland, so it was right there.
You would go and snort heroin on your lunch
On my
break,
lunch break.
and then you go back to treating patients.
Go back to work.
Eventually, she did get caught with a bad drug screen. Her license was suspended, and now she's getting treatment. She's not alone. Records obtained by Action News Investigates show Pennsylvania sanctioned 179 nurses for drug-related offenses in 2014, the most recent year available. That's a 30% increase from just 2 years earlier. And there are 1,100 nurses in treatment programs overseen by the state. Dr. Neil Capretto at Gateway Rehab says nurses have a high-pressure job with easy access to powerful drugs.
There's certainly nurses dying from drug overdose deaths, and sometimes it occurs even in hospitals.
Action News Investigates found multiple cases where nurses diverted drugs from Pittsburgh hospitals. One nurse even did it at 2 different hospitals. In 2010, Nurse John Livingston admitted taking the painkiller fentanyl from Allegheny General Hospital for personal use. He pled guilty to drug possession and went into treatment. The state nursing board put him on probation, which allowed him to get another job at UPMC Montefiore. But in December 2014, Livingston was seen staggering around Montefiore's transplant ICU, glassy-eyed, confused. The hospital fired him after he refused a drug test. He later admitted diverting fentanyl and was again convicted of drug possession. Last year, he surrendered his nursing license. Also last year, Nurse Laura Zawisland pled guilty to multiple drug charges after she admitted diverting oxycodone, Xanax, Percocet, and other painkillers from Allegheny General Hospital. Laura Zwirek, a nurse anesthetist, was given probation after she admitted diverting fentanyl at Mercy Hospital. So are patients being harmed by nurses on drugs? Action News Investigates put that question to the state official who oversees nurses and other licensed professionals.
That's relatively uncommon for nurses to cause any harm to patients. For the most part, what we see is that nurses are particularly harming themselves.
Capretto agrees, but he says sometimes nurses will take drugs meant for patients, possibly causing those patients to suffer.
Not much.
The nurse we interviewed said it does happen.
I was here with somebody recently that, said her patients got water or saline instead of their Dilaudid.
As horrible as that sounds, Capretto says firing nurses too quickly could hurt patients even more.
Unfortunately, that doesn't make drug use go away. That's just going to make it go underground, and actually the public is going to be worse off.
This nurse is vowing to stay off drugs and eventually return to patient care.
I'm an empathetic person. I'm caring. I'm giving, and I'm intelligent. But I'm also an addict, and hopefully, I can put that.
Wow. Wow. Who would have ever thought that nurses would abuse drugs, especially in the workplace? That's a bit bizarre. But I'm going to continue where I left off. As I was saying, does substance use vary between specialties? There's an estimated 40,000 nurses in the U.S. experiencing alcoholism. Studies find higher rates of smoking among psychiatric, critical care, and emergency nurses, and lower tobacco use among oncology and pediatric nurses. Odds of marijuana use are 3 to 5 times higher among emergency nurses. Pediatric and emergency nurses reported a higher use of cocaine than other specialties. Oncology nurses reported the highest overall drug use for all substances combined. Binge drinking was highest among oncology, emergency, and critical care nurses. prescription drug addiction was not as varied across nursing specialties. However, oncology, rehabilitation, and psychiatric nurses did report a tad more prescription drug abuse than other specialties. Should substance use be a part of the nursing school curriculum? Substance use should definitely be a part of the nursing school curriculum, and even have refresher courses for those that are already practicing the profession. The University of Minnesota School of Nursing hopes to change that nationwide. The school has developed a new curriculum to teach students about substance use disorder within the field. They are also often taught about the risk of developing the condition themselves. Jace Gilbertson, a senior UMN nursing student, states, "If I wouldn't have had this curriculum, I don't think I would have been aware of the issue. And if I would have never chosen this topic, I would have never known that nurses or medical professions, abuse substances in the workplace or, on the job, under the influence, per se. But the curriculum covers the risk factors nurses face on the job, as well as how to recognize if a colleague has substance use disorder. Students learn about what support and protections are out there for nurses who are struggling with addiction, including the Nurses Peer Support Network. Consequences and treatment. Your license will be temporarily suspended. You're required to be under supervisory programs that allow nurses to return back to work. Returning nurses will not be able to have access to narcotics and must be constantly supervised by other nurses until licenses are fully restored. It can take months to years depending on the nurse's situation and the state's DON procedure. Nurses are required to sign a contract stating they will undergo rehabilitation, therapy, frequent drug testing, and attend 12-step programs. The good news is those in medical profession who do seek help have a much higher success rate of achieving and maintaining sobriety. Medical professionals, nurses, as well as other staff who receive treatment and participate in ongoing monitoring have a far lower rate of relapse, with over 70,000 still sober, licensed, and employed after 5 years. And that goes my presentation. Thank you.